Ladies and gentlemen, today, we are diving into one of the most debated nutrition questions of our time, a question that almost every household discusses at the breakfast table. How many eggs can you safely eat per day? For decades, eggs have been praised as a powerhouse of protein, then criticized for their cholesterol. Now, with new research and updated medical guidelines, doctors are revealing insights that may surprise you, challenge what you believed, and help you make healthier food choices. In this session, we'll uncover the shocking truth behind daily egg consumption, what it means for your heart, your metabolism, your weight, and your long-term health. So whether you're an athlete who eats eggs daily, a parent preparing meals for your family, or someone trying to lower cholesterol, this information is for you. For decades, eggs have been at the center of nutritional controversy, largely because of their cholesterol content. A single large egg contains about 186 milligrams of dietary cholesterol, most of which is found in the yolk. For many years, health experts believed that consuming cholesterol-rich foods directly raised blood cholesterol levels, increasing the risk of heart disease. This belief led to strict recommendations to limit eggs or avoid them altogether. However, modern science has dramatically reshaped our understanding, revealing a more complex and surprisingly more forgiving picture. Current research shows that dietary cholesterol and blood cholesterol are not as strongly linked as once thought. The body's cholesterol levels depend more on genetics, lifestyle, and the intake of saturated and trans fats rather than dietary cholesterol alone. In fact, the liver naturally produces cholesterol and often adjusts its production based on how much you consume through food. For most healthy individuals, this means eating eggs does not cause a significant spike in blood cholesterol levels. Another important revelation from recent studies is the distinction between LDL, low-density lipoprotein, cholesterol, and HDL, high-density lipoprotein, cholesterol. LDL is often labeled the bad cholesterol because it can build up in artery walls, while HDL is considered the good cholesterol because it helps transport LDL out of the bloodstream. Eggs have been shown to raise HDL levels, which is generally associated with a lower risk of heart issues. Some people may experience a slight increase in LDL after eating eggs, but even then, the type of LDL particles tends to shift toward larger, less harmful forms, reducing the overall risk. However, it's important to note that not everyone responds to eggs in the same way. About 25 to 30% of people are hyperresponders, meaning their blood cholesterol levels may rise more significantly when they consume dietary cholesterol. These individuals may need to monitor their intake more closely, especially if they have a family history of heart disease. Additionally, individuals with conditions like diabetes, high LDL levels, or existing cardiovascular problems may experience different metabolic responses. For them, healthcare professionals often recommend personalized dietary guidelines. Modern nutrition science now emphasizes that the context of your entire diet matters more than a single food. For example, eating eggs alongside vegetables, whole grains, and healthy fats has a very different impact compared to consuming eggs fried in butter or paired with processed meats like bacon or sausages. The way the eggs are cooked, boiled, poached, scrambled, or fried, also influences their health effects. In conclusion, the old belief that eggs should be avoided simply because they contain cholesterol has been replaced by a more nuanced, evidence-based understanding. For most healthy people, eggs can be part of a balanced diet without significantly affecting heart health. The key lies in understanding your own risk factors and consuming eggs in moderation as part of an overall healthy lifestyle. If necessary, personalized medical advice should guide individual dietary decisions. The question, how many eggs can you safely eat per day, has been asked for decades, and the answer has evolved as nutrition science has advanced. Today, the general consensus among most medical professionals and nutrition experts is that eggs can be safely included in the daily diet of healthy individuals, but the ideal number varies from person to person. Understanding this variation begins with recognizing that every body processes cholesterol, fat, and protein differently, influenced by genetics, lifestyle, and overall dietary patterns. Most doctors agree that 1 egg per day is safe for the majority of people. This guideline comes from studies showing that consuming 7 eggs per week does not increase The risk of heart disease in healthy adults. For individuals who have no history of cardiovascular disease, diabetes, or high cholesterol, some research even supports the consumption of up to 2 or 3 eggs per day, provided the rest of the diet is balanced and low in saturated fats. For athletes, bodybuilders, or individuals with high protein needs, daily egg consumption can be a convenient and nutrient-dense option. However, it's crucial to understand that safe does not mean unlimited. While eggs are rich in nutrients, the yolk still contains dietary cholesterol and fat, which may affect certain individuals differently. About 1/3 of the population are hyperresponders, meaning their blood cholesterol rises more sharply in response to dietary cholesterol. For these people, eating multiple eggs per day might not be ideal. This doesn't mean they must eliminate eggs altogether, but moderation and medical guidance become more important. For people with existing health conditions, such as high LDL cholesterol, diabetes, hypertension, or heart disease, the guidelines can be stricter. Many doctors advise limiting intake to 3 to 4 eggs per week or focusing more on egg whites, which provide high-quality protein. Without cholesterol. Diabetics in particular have shown mixed responses in research studies, and some evidence suggests that high egg consumption may increase cardiovascular risk. In these cases, personalized dietary recommendations from a healthcare provider or dietitian are essential. Another factor that influences how many eggs one can safely eat is the overall composition of the diet. For example, someone who eats eggs along with vegetables, whole grains, and healthy fats will experience very different health outcomes than someone who pairs eggs with sausages, processed meats, and unhealthy oils. What you eat with your eggs matters, often just as much as the eggs themselves. Cooking method also plays an important role. Boiled and poached eggs are generally healthier than fried eggs, especially those cooked in butter, margarine, or oil. Pairing eggs with nutrient-rich foods helps balance the meal and reduces negative health impacts. In summary, while 1 egg per day is safe for nearly all healthy individuals, and 2 to 3 eggs per day may be fine for many, there is no universal number that fits everyone. Personal health status, genetic factors, lifestyle, and overall diet determine what is truly safe. The most balanced approach is moderation, mindful eating, and professional guidance for those with specific medical concerns. Eggs have long been recognized as one of the most nutrient-dense foods available, earning the title of a natural multivitamin. Despite their small size and simplicity, eggs pack an impressive array of essential nutrients that support overall health, making them a valuable addition to many diets worldwide. Understanding the nutritional richness of eggs helps explain why they remain a staple in countless households and why doctors continue to acknowledge their benefits when consumed in moderation. One of the most remarkable features of eggs is the high-quality protein content. Each egg contains about 6 to 7 grams of complete protein, meaning it provides all 9 essential amino acids the body cannot produce on its own. These amino acids are essential for building and repairing tissues, supporting muscle growth, maintaining strong bones, and enhancing immune function. For athletes, growing children, and individuals recovering from illness, this makes eggs an excellent protein source that is both affordable and highly bioavailable. Beyond protein, eggs are rich in vitamins and minerals that play critical roles in maintaining health. For instance, eggs are one of the few natural dietary sources of vitamin D, a nutrient crucial for bone health, immune function, and mood regulation. Many people around the world are deficient in vitamin D, and eggs can help fill this nutritional gap. Additionally, eggs contain vitamin B12, vitamin A, riboflavin, and folate, nutrients important for energy production, vision, skin health, and proper functioning of the nervous system. Another standout nutrient found in eggs is choline, a compound essential for brain function, liver health, and cell membrane integrity. Choline is especially important for pregnant women because it supports fetal brain development and reduces the risk of neural tube defects. Surprisingly, many people do not get enough choline from their regular diets, and eggs are considered one of the best and most convenient sources of this vital nutrient. Eggs also provide powerful antioxidants, including lutein and zeaxanthin, which are known to protect eye health. These antioxidants help reduce the risk of age-related macular degeneration and cataracts, two common vision problems that often affect older adults. The presence of these protective compounds makes eggs an excellent addition to a diet focused on long-term eye health. For individuals concerned about health. Why fats? Eggs offer a balanced profile of unsaturated fats, which support heart and brain function. Some eggs, especially those labeled as omega-3 enriched, contain higher levels of omega-3 fatty acids, known for their anti-inflammatory properties and potential to reduce the risk of chronic diseases. What makes eggs even more beneficial is their versatility and digestibility. They can be cooked in countless ways, paired with nearly any meal, and absorbed easily by the body. Whether boiled, scrambled, poached, or baked, eggs provide consistent nutrition that is simple to prepare and budget-friendly. In summary, the nutritional power of eggs lies in their combination of high-quality protein, essential vitamins and minerals, healthy fats, and antioxidants. These qualities make eggs a valuable food for people of all ages, contributing to stronger bodies, healthier brains, and better overall well-being when consumed as part of a balanced diet. While eggs are widely celebrated for their nutritional value, it is equally important to understand when they may become harmful. As with most foods, the health impact of eggs depends on the individual consuming them and the way they are prepared and incorporated into the overall diet. Although many people can safely enjoy eggs daily, others may need to exercise caution due to certain health conditions or dietary patterns that increase risk. One of the primary concerns associated with egg consumption is its cholesterol content. Although modern research shows that dietary cholesterol affects individuals differently, some people fall into a category known as hyperresponders. These individuals experience significant increases in LDL, bad cholesterol, when they consume foods high in cholesterol, including eggs. For hyperresponders, eating multiple eggs per day may lead to elevated LDL levels, potentially increasing the risk of plaque buildup in the arteries and contributing to long-term cardiovascular problems. Identifying whether you are a hyperresponder often requires blood tests and professional medical guidance. Egg consumption can also become risky for individuals with pre-existing health conditions, especially those related to the heart and metabolism. For example, people with type 2 diabetes have shown mixed responses to eggs in scientific studies. While some research suggests eggs can fit into a diabetic-friendly diet due to their low carbohydrate content and high protein quality, other studies indicate that consuming eggs frequently may increase cardiovascular risk in diabetics. Because diabetes already elevates the likelihood of heart disease, adding too much dietary cholesterol may compound the risk for certain patients. Individuals with familial hypercholesterolemia, a genetic condition that causes extremely high LDL cholesterol levels, must also be cautious. Even moderate consumption of eggs might worsen cholesterol management in these cases. For such people, doctors often recommend minimizing dietary cholesterol and focusing on egg whites rather than whole eggs. Another risk factor involves not the egg itself, but the way it is prepared. Eggs cooked in butter, oils, or margarine, especially trans fat-containing spreads or highly saturated fats, can dramatically increase the risk of heart problems. When eggs are frequently paired with processed meats such as bacon, sausages, or ham, the meal becomes significantly more harmful than the eggs alone. These processed meats are linked to inflammation, high sodium intake, and increased cancer and heart disease risk. As a result, it's often the overall meal composition, not just the egg, that turns a healthy food into an unhealthy choice. Food safety is another area of concern. Undercooked or raw eggs carry the risk of salmonella contamination, which can cause severe gastrointestinal illness. While most commercial eggs are safe, vulnerable groups, including pregnant women, young children, older adults, and individuals with weakened immune systems, should avoid raw or improperly cooked eggs altogether. Finally, excessive egg consumption can crowd out other important food groups. Relying heavily on eggs for protein may reduce dietary variety, leading to deficiencies in fiber, antioxidants, and plant-based nutrients. In summary, eggs become potentially harmful when consumed in excess, cooked in unhealthy fats, paired with processed meats, or eaten by individuals with specific health vulnerabilities. Moderation, mindful preparation, and personalized medical advice are key to safely enjoying this nutritious food. Knowing how many eggs you can safely eat is important, but equally important is how you prepare them. The health impact of eggs can vary dramatically depending on cooking method, added ingredients, and the foods you pair them with. The same egg that offers high-quality protein and essential nutrients can become unhealthy when drowned in oil, butter, or processed meats. Therefore, making smart cooking choices can maximize the benefits of eggs while minimizing potential risks. One of the healthiest approaches is to prepare eggs using low-fat cooking methods, such as boiling, poaching, or steaming. These techniques require little to no added oil, keeping the calorie and fat content controlled. A boiled or poached egg retains all its vitamins, minerals, and protein without introducing harmful compounds that arise from high-heat frying. Hard-boiled eggs in particular are convenient, portable, and ideal for meal prep. Scrambled eggs can also be healthy if made correctly. The key is to avoid excessive butter, margarine, or cream. Using a nonstick pan, a splash of water, or a tiny amount of olive oil, and adding vegetables like spinach, tomatoes, or bell peppers transforms scrambled eggs into a nutrient-rich meal. The vegetables add fiber, antioxidants, and volume, making the dish more balanced and filling. Another aspect to consider is the foods traditionally served with eggs. Pairing eggs with processed meats like bacon, sausages, and ham add high levels of sodium, saturated fats, and preservatives, which negate many of the nutritional benefits of eggs. A much healthier alternative is to pair eggs with whole grains, such as oatmeal, whole wheat toast, or quinoa, to provide sustained energy and dietary fiber. Fresh vegetables or avocados are also excellent companions, offering vitamins, heart-healthy fats, and improved satiety. Egg yolks contain the majority of the egg's fats and cholesterol, while the whites provide pure protein with no fat. For individuals who need to limit cholesterol or reduce calorie intake, such as those with heart disease, high LDL cholesterol, or diabetes, using a mix of whole eggs and egg whites is a simple strategy. For example, preparing an omelet with 1 whole egg and 2 egg whites still delivers great flavor and texture while reducing cholesterol and saturated fat. Aside from preparation and pairing, portion control plays an essential role in maintaining a healthy relationship with eggs. Even the healthiest cooking methods don't justify excessive intake for individuals with medical conditions. Moderation ensures you receive the nutritional benefits of eggs without unnecessary risks. It's also important to consider the quality of the eggs you consume. Eggs from free-range or omega-3 fed hens tend to have higher levels of beneficial omega-3 fatty acids and may contain more vitamins. These options are generally healthier and can enhance the nutritional profile of your meals. Finally, food safety must not be overlooked. Always cook eggs thoroughly to reduce the risk of salmonella, especially for vulnerable individuals such as pregnant women, infants, the elderly, and immunocompromised people. In summary, the healthiest way to eat eggs comes down to choosing smart cooking methods, pairing them with nutritious foods, practicing moderation, and focusing on overall dietary balance. By doing so, you can enjoy eggs as a delicious, versatile, and nourishing part of your daily diet while protecting your long-term health.